If you are over 70 and you routinely sleep on your left side because you were told it is better for your heart, you may be unknowingly placing strain on a system that is already more vulnerable with age. This is one of those habits that feels safe, even recommended. Many people adopt it without a second thought. But in older adults, especially those with blood pressure issues, heart conditions, or circulation problems, the story is not that simple. What feels comfortable at night can quietly influence how your heart pumps, how your blood circulates, and even how your brain is supplied with oxygen while you sleep. And that is where the real risk begins. I am speaking to you not just as an observer, but as someone who has spent over 2 decades working with older patients dealing with heart strain, stroke recovery, and nighttime circulation issues. I have seen patterns repeat, small habits repeated every night, leading to consequences that seem sudden but are not. Let me tell you about one patient. He was 74, stable blood pressure, mild heart enlargement, nothing that seemed urgent. He slept almost exclusively on his left side because he believed it helped his digestion and heart function. Over time, he began waking up with mild dizziness. Occasionally, he felt pressure in his chest at night, nothing severe enough to alarm him. Until one morning, he experienced a brief loss of balance getting out of bed. That episode turned out to be a warning sign of reduced blood flow to the brain. What we discovered was not a single dramatic cause, but a combination of factors, one of which was how his body position at night was affecting his cardiovascular system. Now, this does not mean sleeping on your left side is always dangerous, but it does mean that after 70, your body responds differently to positions that once felt harmless. Your heart is not pumping the same way it did at 40. Your blood vessels are not as flexible. Your circulation does not adjust as quickly. So the real question is not just how you sleep, but what that position is doing inside your body over several hours, every single night. And to understand that, you need to see what is actually happening beneath the surface. Because what most people assume about sleep position is only part of the story. Most people believe that sleeping on the left side is automatically heart-friendly. You may have heard that it improves circulation, reduces acid reflux, and supports overall comfort. And in younger or otherwise healthy individuals, that can often be true. But after 70, your body does not respond in the same predictable way. Here is what is actually happening. Your heart is not sitting in isolation. It is positioned slightly to the left side of your chest, surrounded by lungs, major blood vessels, and structural tissues. When you lie on your left side, gravity shifts the position of these structures. In a younger body, the heart and blood vessels adjust easily. The vessels remain flexible and the heart compensates without strain. But in older adults, especially those with stiffened arteries or mild heart enlargement, that adjustment is not always smooth. Think of your blood vessels like flexible pipes. When you are young, those pipes can bend and adapt without resistance. But with age, those same pipes become more rigid, less responsive, and sometimes partially narrowed. Now imagine lying in a position that slightly compresses or shifts those pipes for hours at a time. That is what can happen when you consistently sleep on one side, particularly the left. This position can increase pressure on the heart's left side, which is responsible for pumping oxygen-rich blood to your entire body, including your brain. If that flow becomes even slightly less efficient, especially overnight, your brain may receive less oxygen than it needs, and here is where it becomes serious. Reduced nighttime circulation does not usually cause immediate symptoms. Instead, it creates subtle effects: morning dizziness, slight imbalance, mental fog, or brief weakness when you first stand up. These are often dismissed as just aging, but they are not random. They can be early signals that your cardiovascular system is under strain during the very hours it should be recovering. Before I show you what to change, you need to understand the first major warning sign most people overlook, and why it matters more than you think. One of the first warning signs that your sleep position may be affecting your circulation is something many older adults experience but rarely question: morning dizziness or lightheadedness when you sit up or stand. Most people assume this is simply part of aging. They blame it on getting up too quickly, dehydration, or poor sleep. And while those factors can play a role, they often mask a deeper issue. What is actually happening involves a condition called orthostatic hypotension. This is when your blood pressure drops suddenly as you change position. In a healthy system, your body compensates quickly. Blood vessels tighten, heart rate adjusts, and blood flow to the brain remains stable. But after 70, that response becomes slower. Now combine that with hours spent in a position that may already be slightly reducing optimal blood flow. When you wake up and change position, your system is starting from a disadvantaged state. Think of it like turning on a water system that has been under low pressure all night. The initial flow is unstable. That moment of instability can cause dizziness, blurred vision, or even a brief sense of disorientation. And this matters more than most people realize, because that moment, right after getting out of bed, is one of the highest risk times for falls in older adults. A single misstep, a brief loss of balance, can lead to injury, loss of independence, or hospitalization. So what should you do? First, do not rush out of bed. Sit upright for a minute. Let your circulation stabilize. Move your feet and legs gently to encourage blood flow. Second, consider alternating your sleep position. Do not remain fixed on your left side for the entire night. Even small adjustments can reduce prolonged pressure on one side of the cardiovascular system. This is a simple change, but it can reduce strain and improve how your body transitions from sleep to movement. But morning dizziness is only the beginning. There is another, more subtle signal that often appears at night, and this is where the situation becomes more serious. Another overlooked sign that your sleep position may be affecting your heart and circulation is nighttime chest discomfort or a sense of pressure. This does not always present as sharp pain. In fact, most older adults describe it as heaviness, tightness, or a vague discomfort that comes and goes. Because it is not severe, it is often ignored. But it should not be. When you lie on your left side, especially for extended periods, the heart shifts slightly within the chest cavity. In individuals with even mild heart enlargement or fluid retention, this position can increase the sensation of pressure. Now, this is where the misunderstanding happens. People assume that discomfort must be intense to be dangerous, but in older adults, warning signs are often subtle. The body does not always produce dramatic symptoms. Instead, it gives quiet signals. That nighttime pressure may be your heart working harder to maintain circulation against gravity and structural compression. Over time, this increased effort can contribute to fatigue of the heart muscle. It can also affect how efficiently blood is delivered to vital organs during sleep. And remember, sleep is when your body is supposed to recover. If your heart is under strain during those hours, recovery is compromised. So what is the practical step here? If you notice any form of chest discomfort when lying on your left side, even mild, try adjusting your position. Shift to your right side or slightly elevate your upper body with a pillow. Elevation can reduce pressure and improve circulation dynamics. Also, pay attention to patterns. Does the discomfort improve when you change position? That information is valuable because it tells you your body is responding to mechanical factors, not just internal disease. But this leads to a deeper issue that most people completely miss. What happens to your brain when circulation is subtly affected night after night? The brain is one of the most sensitive organs when it comes to blood flow. Even small, repeated reductions in oxygen supply can have cumulative effects over time, and this is especially important after 70, when the brain is already more vulnerable to changes in circulation. Many people worry about dementia or memory loss, but they often overlook how nightly habits contribute to long-term brain health. Here is what can happen. If your sleep position consistently reduces optimal blood flow, even slightly, the brain may not receive the steady oxygen supply it needs during deep sleep. Deep sleep is when your brain clears waste products, consolidates memory, and restores neural function. If that process is interrupted or weakened, the effects may not be immediate, but over months and years, they can accumulate. You may notice subtle changes first: slower recall, difficulty concentrating, or a sense of mental fog in the morning. These are often dismissed, but they can be early signs that the brain is not being fully supported during sleep. Now, this does not mean your sleep position alone causes dementia. That would be an oversimplification, but it can be one contributing factor in a larger pattern. So what can you do? Prioritize positions that allow comfortable breathing and minimal pressure. Use pillows to support alignment. Keep your head slightly elevated to assist circulation. And most importantly, do not ignore consistent morning cognitive symptoms. They are not just normal aging. They are signals, but the brain is not the only system affected. There is another area where the impact of sleep position becomes more visible and sometimes more dangerous. Before we go further, I want to ask you something simple. Have you ever noticed numbness, tingling, or heaviness in your arm or shoulder when you wake up, especially on the side you were sleeping on? If that has happened to you, you are not alone. And if it has, I want you to take a moment and acknowledge it, even if you have always brushed it off. This is important because that sensation is not just about sleeping wrong. It is often a sign of temporary nerve compression and reduced blood flow. When you lie on one side for extended periods, especially if circulation is already compromised, pressure builds on nerves and blood vessels. In younger individuals, the body corrects this quickly. But after 70, recovery is slower. That tingling may linger longer, the arm may feel weaker, grip strength may be slightly reduced for a short time. These are small signals, but they matter. If you have experienced this, it means your body is already showing sensitivity to prolonged pressure during sleep. So here is what you can do immediately. Avoid staying in one fixed position for the entire night. Use pillows behind your back to encourage gentle position shifts. Support your arms so they are not compressed under your body. Even small adjustments can relieve pressure and improve circulation. And if you are comfortable, I want you to think about this. How often does this happen in a week? Because frequency matters. Now, what I'm about to explain next is even more serious, because it involves a risk that many people never connect to sleep position at all. One of the most concerning risks associated with prolonged poor circulation during sleep is its potential link to stroke. Now, let me be very clear. Sleeping on your left side does not directly cause a stroke, but in certain individuals, especially those over 70 with existing vascular issues, it can contribute to conditions that increase risk. Here's how. Your blood vessels, particularly in the neck and brain, are responsible for maintaining steady blood flow. When circulation is compromised, even slightly, blood can move more slowly, and slower blood flow increases the likelihood of clot formation. Think of it like a river. When water flows freely, it remains clear. But when it slows down, debris can accumulate. In your body, that debris can become dangerous. Now combine that with reduced vessel elasticity, higher blood pressure, or underlying plaque buildup. This is where the risk compounds. If your sleep position contributes to uneven or restricted flow over long periods night after night, it may become one small factor in a much larger risk picture. This is why some strokes occur in the early morning hours or shortly after waking. The system has been under strain overnight. So what is your role in prevention? Maintain variability in sleep position. Support your neck properly to avoid vessel compression. Keep your blood pressure well managed. And most importantly, recognize that small, repeated habits matter. because prevention is rarely about one big change. It is about many small, correct decisions. But there is still one more overlooked factor that ties all of this together. What most people miss in this entire discussion is the role of breathing during sleep. Your sleep position directly affects how well your lungs expand and how efficiently oxygen enters your bloodstream. When you lie on your left side, especially if your posture is slightly curved or compressed, lung expansion on that side can be reduced. In older adults, lung capacity is already lower than it was decades earlier. So even a small reduction in expansion can affect oxygen levels. This is not something you feel immediately, but over several hours it can influence how well your body and your brain are oxygenated. Poor oxygenation contributes to fatigue, confusion, and even cardiovascular stress. So what is the practical response? Focus on open, supported positioning. Keep your chest slightly elevated. Avoid positions that compress your torso. If you notice snoring, breath interruptions, or waking up feeling unrefreshed, take that seriously, because breathing quality is directly connected to circulation and heart function, and improving it can have a powerful effect on your overall health. Now let us bring all of this together into clear, practical steps you can take starting tonight. At this point, you may be wondering, what exactly should I do? Let me make this simple and clear. First, do not lock yourself into one sleep position all night. Your body benefits from gentle variation. If you prefer your left side, that is fine, but do not remain there for hours without adjustment. Second, use support strategically. A pillow behind your back can help you shift slightly without rolling completely. A pillow between your knees can improve alignment. Elevating your upper body slightly can reduce pressure on the heart and lungs. Third, pay attention to your morning signals. Dizziness, imbalance, tingling, mental fog. These are not random. They are feedback from your body. Fourth, move slowly when waking. Sit, breathe, and allow your circulation to stabilize before standing. Fifth, monitor patterns. If symptoms improve when you change position, that is meaningful information. And finally, speak to your doctor if you have persistent symptoms, especially if you have a history of heart disease, stroke, or blood pressure issues. You do not need to guess. You need to observe, adjust, and respond. Because small nightly habits can either support your health or quietly work against it. And the difference often comes down to awareness. Now let me leave you with something important to remember. What we have talked about today is not meant to create fear. It is meant to give you awareness. Because the truth is, your body after 70 is more sensitive, but it is also more responsive to the right adjustments. Sleeping on your left side is not automatically dangerous, but doing it without awareness, without variation, and without understanding your own body's signals, that is where the risk can grow. The real danger is not the position itself. It is ignoring what your body is trying to tell you. So here is one simple action you can take tonight. Before you go to sleep, set up your pillows in a way that allows gentle movement. Do not lock yourself into one position. Give your body options. And when you wake up, take a moment to notice how you feel. That awareness alone can prevent problems before they become serious. If this information helped you, I encourage you to share it with someone who may need it, especially another older adult who may be experiencing these same subtle signs. And if you want more clear, medically grounded guidance on protecting your heart, your brain, and your independence as you age, consider subscribing, because the goal is not just to live longer, it is to stay in control of your health while you do. Take care of your body, listen to its signals, and respond early. That is how you protect your future.